All right, welcome everyone. I'm Audra Burns from Dartmouth Health. Thank you for joining us today for this webinar about the new COVID-19 bivalent vaccine. So our goal for this webinar is to give you the facts about the vaccine and to help you wade through and dispel the myths that you might be hearing about. The format for today will be our two panelists talking about the subject for about 5 to 10 minutes each, and then we're going to open it up to the floor for your questions which will last about 10 minutes. So if you would like to ask a question of our panelists, please use the Q&A feature during the webinar. We're going to get to as many questions as we can during our time period that we have allocated, and our panelists will respond. If they miss any, we will be recording those and include them with the recording. This webinar is, like I said, being recorded and captioned so that we can share it with anyone who is not able to join us today. We're very fortunate to have two incredible experts joining us to talk about the current state of COVID, the new variants, the effectiveness and the safetiness of the vaccine, and why boosters are recommended. They're also going to discuss what else we can do to stay safe, especially as the winter months are coming. So let me introduce our first panelist, which is Dr. Michael Calderwood. He is an infectious disease specialist and the Chief Quality Officer at Dartmouth Hitchcock Medical Center. He manages the integration and safety of quality of patient experience and process improvement activities, including the oversight of assurance and regulatory compliance. Now, Dr. Calderwood and his team, they develop policies and programs and metrics and report out accountability to influence culture, engage our staff, and lead improvement work. Relevant to today's webinar, Dr. Calderwood has been actively engaged with Dartmouth Health in our system response since the very start of COVID-19. He is excited to share with us some insights and where we stand on the pandemic and answer your questions, so please use that Q&A function. Our other panelist joining us is Dr. Sally Kraft. She is the Vice President of Population Health at Dartmouth Health. She leads a multidisciplinary team dedicated to improving the health of populations across the region served by Dartmouth Health. The population team works to improve care and the clinical conditions in the community and to make sure that each person has the opportunity to be as healthy as possible. Population Health has coordinated vaccination efforts across our efforts through our system and through our community for the COVID-19 and flu for both employees, patients, and our community. Now, Dr. Kraft has led and provided leadership on the critical role of vaccines in public health during COVID-19 pandemic and is an expert and advocate on population health and improving health outcomes in our community. So as you can see, we have two excellent panelists. So why don't we go ahead and get started with you, Dr. Calderwood. So it might be helpful to have kind of a quick update on the current state of COVID before we begin our discussion on the vaccines. You know, we've heard everything from the pandemic is over or COVID's going to be with us forever. So can you help us understand the status of the pandemic as we approach the winter months and what you see the trajectory of what the pandemic's going to look like? And, you know, what are we facing? What should we be thinking about in the coming months? I'll turn it over to you, Dr. Calderwood.
Thank you, Audra, and happy to be here. I'm going to go to the next slide. And to help us kind of navigate through the slide before that, there we go. I did put some slides together. Again, these are to set the stage, and I'm really looking forward to the Q&A. As you can see here on the left, there are some very encouraging trends. We are seeing that case counts, deaths, hospitalizations, and the mortality for those who actually get sick with COVID-19 are all going down. And this is related to increased immunity within the community. We're seeing large protection from vaccination, as well as individuals who have, over the course of this pandemic, been infected. We know those who have been recently vaccinated or recently infected have the most protection, and that tends to wear off over time. And so if you were infected earlier on, it is important to understand that some of the protection you have is no longer present. And so I'm going to speak a little bit about some of the newer things that we have in terms of vaccines. But in addition to that, we do have some good treatments available for those who get sick. And that's a big driver in terms of the better outcomes that we're seeing. So it's a much different time now than it was, say, almost 3 years ago at this point when the pandemic was starting. Now, COVID-19 and the virus that caused it it's a respiratory virus. And so we know that each winter, we tend to see increases. It then tends to fall off in the later spring. We have seen smaller increases through each summer, often related to a lot more social activities. And then again, it drops off through the fall and picks up around Thanksgiving. So we do expect that cases and hospitalizations and even deaths will increase as we go into the winter months. As much as we are able to predict, there is an expectation that it will not be as bad as it was last winter. That was the worst winter yet in the pandemic. And we had kind of a new variant that was circulating. It was a lot more transmissible. But right now, we actually have a lot of protection against that. Next slide. Now, many are hearing about newer booster vaccines, particularly those that have protection against the latest Omicron, and this is the BA.5 variant. That's currently what's causing the majority of infections out in the country. We now have some very good data on these booster vaccines. And the prediction, so if you look here on the left of this slide, in purple is the modeled expectation of what we will see going out through the winter and into the early spring in terms of projected hospital counts and projected deaths from the virus. That's the trajectory if we see vaccination continuing at the current rate. What we would expect if we could get as much as 80% of those who are eligible boosted, meaning up to date with the current vaccines, is that we would see 90,000 fewer deaths and over 935,000 fewer hospitalizations by the end of March 2023. Now, I will say that getting 80% vaccinated is a large goal. So you can see there in blue what is predicted if we were to get as many vaccinated as typically come forward to get an annual flu shot. And even at those rates, the impact is huge. And so we have to understand that this is like any other respiratory virus. It has seasonal variation, and we have vaccines that can protect, much like we do each year coming up and getting our flu shot. Next shot. So how does the booster help? We actually now have very good data for a lot of questions people have been asked. If you are up to date on the COVID-19 vaccine series, including a recent booster dose, we know that you end up having milder illness and quicker improvement. Doesn't mean that everyone experiences that. There are some that, because they have an impaired immune system, either from illness or medication, can still get quite sick. But on the whole, those who are up to date have much milder illness and quicker improvement in symptoms. We also know that there is significant reduction in hospitalization and death, and that's now been shown all the way down to the youngest ages. And I've shown on the left data and reductions in hospitalization through August of 2022, and that's the most recent data that we have. We will soon have September as well, but you can see between 72 and 87% reduction amongst those who have had a booster, and similar numbers even down in looking at ages 12 to 17. We're hearing a lot about long haul COVID, and these are persistent symptoms in people who've recovered from the acute illness. This is a huge number. This is going to continue to be something that we are addressing for a long period of time. The vaccines can reduce the risk of that long haul COVID by about 35 to 40%. And so we know the vaccines are good in that protection as well. And then finally, even amongst those that get sick, we know that certain therapies, such as our monoclonal antibodies, actually perform better in those who are already vaccinated. So having been vaccinated improves your response to some of these therapies. Next slide. We now have newly published data on the bivalent vaccine, and this just came out in the New England Journal. But we have human studies on the immune response to these bivalent Omicron-containing boosters. This means that they have both the code for the original ancestral circulating virus and the most recent virus that's out in the community. If you get this bivalent vaccine, we actually have seen that you have superior protection, higher antibody levels against the most recent circulating virus that's in the community. That's true even for people who've had a prior infection. And the reactions, these are 800 individuals, 400 that got the original booster, 400 that got the bivalent booster, but the reactions to the vaccine were no different in the two groups that had these vaccines. What we know is that if you tended to have had reactions to the original vaccines, you'll have a very similar reaction to these boosters. And it tends to actually be less over time. So people often will react to their first or second shot more so than they do to later shots. And what I would say is for those who've had a fever, we know that you tend to be more likely to get a fever, but you can take things like Tylenol and it won't impact your response to the vaccine. So a lot of people are taking some medicine to help manage some of these symptoms. Next slide. And so with that, I'm actually going to turn over to Sally, allow her to give her update, and then we're going to take some questions. Thank you.
Great. Thank you, Dr. Calderwood. That was very informative and excellent to see the science behind it on those slides. So Dr. Kraft, can you share how we're doing with the COVID-19 vaccinations now and the new updated booster is available? I'd also like you to kind of cover, why vaccination rates are high in some areas of our region, yet low in others. So I'll turn it over to you, Sally.
Great. Thank you, Audra. Well, the science of the vaccines is evolving and we're getting better, but it's one thing to have the vaccine, it's another to get that vaccine into people's arms. So we've learned a lot about how to do that as well. Next slide, please. As we can see, overall, for that primary series, that's those first 2 shots for the mRNA or a single shot for the Johnson & Johnson, we've got a national immunization rate of about 68% for the primary series. And you can see here in New Hampshire, we're at about 66%, and in Vermont, as high as 80%. Vermont has really been one of the exemplars in the United States. But we've seen less uptake of the boosters. The next slide, please. And we know that less than half of the people in the United States who are eligible for a booster, and this is all the boosters, not just the bivalent booster or the updated booster, but less than half of the people in the United States who are eligible for a booster have actually received that booster. For the elderly population, they've tended to have higher primary vaccination rates and booster rates, but you can see that it falls off with age. We know just as of yesterday, the data that was coming in is that about 11.5 million people have received that updated or bivalent booster that Dr. Calderwood was talking about. And that's probably only about 5 or 6% of the eligible population. Again, eligibility in this case is really largely related to ages. In New Hampshire, our rate of our population that's eligible, that's received a single booster, is only 32%. So only a third of our fellow New Hampshireites have received a booster, and in Vermont, that rate is 53%. And what's alarming is, as Dr. Calderwood said, these boosters really are important in terms of keeping our immune system strong and decreasing the risk of severe disease and hospitalization. And in particular, now as the evidence is mounting, decreasing the risk of long COVID, which, as Dr. Calderwood mentioned, can be a devastating disease, especially in a young person who's been healthy and active, and all of a sudden to be faced with long-term, really disabling symptoms. So the boosters are important right now, and we need to increase these rates. The new bivalent booster, which has been available, or updated booster, you'll hear it referred to both ways, bivalent or updated, has been available since the beginning of September. But a recent survey showed that less than 50% of the US population was even aware of this booster. So webinars like this, talking to your friends and family, keeping up to date is really important, because the science has evolved quickly and we need people to be getting their updated boosters rapidly at this point in time as we move into the fall and into the winter. Next slide, please. We've seen enormous variation in vaccination rates across the country, as the first slide indicated, and even right within states and within neighborhoods. And there's a lot of reasons for those vaccination variations. You can see here, this is a map showing the percent of the population by county in New Hampshire who's received one booster, at least one booster. And you can see Grafton at 37%. And then if we just go down south along the Connecticut River, we can see how that booster vaccination rate drops off. And there are many reasons for this vaccination. Do you all remember, it was just a couple of years ago that only certain job occupations could get the vaccine. We started doing vaccines in Dartmouth Health in December of 2020, when the first responders and healthcare providers could get the vaccine. And then the ages would shift. So it was not until the spring of this year that babies 6 months and up could get the vaccine. So some of the reason for variation has been related to how the vaccines are rolled out and who's eligible for the vaccines. But really what we've developed over time is an enormous increase in accessibility to the vaccines. So it's pretty easy to get a vaccine now. You can go to a pharmacy, a drugstore, a healthcare setting. The availability of the vaccines is fairly widespread. There's still definitely people who, if you're homebound or don't have transportation, it may be difficult to get to a vaccine. But all in all, that doesn't account for that full, look at 11% percentage point difference from county to county here in New Hampshire. So there are other reasons that people are choosing not to get the vaccine, even though it is accessible. We know that the knowledge about the vaccines has changed rapidly. There may be some confusion about that. Hence the value of doing these kind of webinars and town halls and getting information out as best that we can, talking to friends and family. And we also know that each of us as individuals or parents of children are making a decision. Should I get vaccinated or not? And we weigh many different factors when we make that decision. Is the vaccine safe? The answer is yes, but that's what you think. Is the vaccine safe? Is it effective? Is it going to prevent me from getting the disease? As Dr. Calderwood just outlined, it prevents severe disease and hospitalization in a really large proportion of people who get the vaccinations and boosters compared to those who don't. And there are also some troubling developments over the last several months and years about misinformation or false information about the vaccines. Next slide, please. Sometimes you'll hear people talk about vaccine myths. I don't like to use the word myth because these aren't myths. They're just misinformation or bad information. And we have had to really deal with a lot of that misinformation, and actually sometimes people have deliberately provided disinformation or bad information for really nefarious reasons. So let me just start off by saying there have been a lot of changes, and I think it would be easy to sit back and say, you guys don't know what you're talking about. It's changing all the time. It's too confusing. I don't really trust this. Let me just say the fact that it is changing is evidence that what we're doing is we're developing the science, And we are learning continuously and updating as the science dictates. And we also know that this virus has mutated and changed over time. So as Dr. Calderwood said, the bivalent vaccine is addressing not only the original virus, but also the Omicron variants. And it's really important for all of us to get the best information that we can from trusted sources. When we talk with people, we need to lead with facts. These are the facts. When we hear misinformation, we should alert people and say, that's not the facts as I understand them from my trusted sources of information. When we hear something that's frankly wrong, we need to call that out and say, that is not correct. And then we need to end with the facts and just be calm and deliver the facts really with confidence. It does not do any of us any good to get into an argument and to repeat over and over what the fallacy is or what that disinformation is. Simply acknowledge that that is not correct information and leave people with the facts and with trusted sources of information. And my last slide, if you can proceed to the next slide, we'll give just a couple of sources of information where I go to find out about the science and the vaccines, where they're available, and what the current recommendations are. We have a Dartmouth Health COVID-19 vaccine testing and treatment webpage. The Centers for Disease Control and Prevention, the CDC, has a lot of dense information, but they also have some information that they have nice infographics and make it really clear. To find vaccines close to you, there's a website that you can go to, www.vaccines.gov. And both the states of New Hampshire and Vermont have excellent websites to give you lots of good information about the science, about the vaccines, and where you can find those vaccines. So I'll just end by saying the vaccines are safe, they're effective, there's good information out there, and make sure that you get your questions answered from a trusted source of information.
That's wonderful. Thank you, Dr. Kraft. And for our viewers, if you have questions from our medical experts, please put them in the Q&A. We're actually going to turn it over now to some of the questions that we have coming in. And we are going to start. We have one for you, Dr. Calderwood. This viewer writes, a friend of mine had a heart attack recently, and his daughter, who is a heart doctor in Washington State, has reported an increase in heart attacks in patients who have had a recent booster. Can you speak to that?
So it's actually something that's been studied quite closely, and we most certainly through the past few years of the pandemic have been seeing a rise, actually it began well before vaccines, in inflammation of heart vessels leading to things like heart attacks and stroke. And actually, if you look at what is causing that, it is the virus itself and the immune system's response to that virus, much more so than the vaccine. And when you look at the rates of what we're seeing as far as adverse effects from the vaccine, you can find that there will be cases of things like myocarditis, and this is going to be a temporary inflammation of the heart muscle. That in the highest risk group, which would be kind of males between the ages of 12 and 17, is kind of down in the range of 1 in 10,000 to 1 in 100,000. And if you actually look at the cases, they tend to be kind of short-lived with no long-lasting effects. I will say, having cared for a number of patients with COVID and those with kind of the post-COVID complications, we have seen a lot of significant heart attacks and strokes from the virus itself at a much higher number than we're seeing in terms of complications from these vaccines. And so it really, if you look at your protection, the protections from these vaccines are reducing. And we have to recall, in 2020 and 2021, deaths from COVID-19 were overall the third leading cause of death, and there were months where it was the top leading cause of death across the country.
Thank you for that insight. We have another question. Dr. Kraft, this one probably good for you. You mentioned about the Vaccine.gov website about where people can find it, but this one's asking specifically if the bivalent vaccine is available within the Dartmouth Health system. If so, where and how can they book those?
Yeah, it is available. We are turning a lot of our vaccine attention to the flu right now, in addition to COVID-19. So you can get both your influenza vaccine and your COVID-19 bivalent booster at Dartmouth Health. And I would recommend actually getting both, or at least considering getting both. It's very convenient. You don't have to make 2 appointments, come and go. You can get one in one arm and one in the other. It's safe to get both. You don't have an increased risk of adverse effects. Each vaccine has a very similar mild side effect profile to the vaccine. It's usually sore arm. Maybe the next day you don't feel really great. Sometimes a very low grade fever, but that tends to go away within at least 1 or 2 days. It's not long lasting. So it's safe to get both vaccines at the same time, and you can get both vaccines here at Dartmouth Health. The best way to schedule that is to go on MyDH. And if you don't have MyDH, if you go to the website, if you're a patient, you can sign up and activate your MyDH. That's our patient portal. And you can just make your appointment right then. You don't even have to call. If you don't have a MyDH account and you can't set one up, or you're not a patient here in the Lebanon area, you can call the hotline. And that hotline, again, if you just go to the internet, you'll get the numbers. And you can schedule an appointment for both COVID-19 and for the flu. For our employees, on Tuesdays and Thursday mornings, there are appointments that you can schedule for your COVID-19 vaccine. And when you go to get your COVID-19 vaccine, the bivalent booster, you can get your influenza vaccine at the same time. So there are appointments. If you go to the Dartmouth Health site and everything's full, you can go to the vaccine locator, or you can call around to your local pharmacies, Price Chopper. They're really readily available, both the flu and the COVID-19 boosters.
Great, thank you. I did the double, the booster and the flu shot, one in each arm, which actually leads me to a question we have right now from another viewer for you, Dr. Calderwood. Is there going to be an opportunity for a combo flu and bivalent vaccine in the future? Looks like they're wondering if that's going to be a one shot in the future.
Yes, and actually there was a hope that we were going to have it this year, but they went back and reformulated the bivalent because of the newer circulating variants. But by next year, we should have a combination flu and COVID vaccine. I will say I also got on the same day my flu and my COVID bivalent vaccine. I will say, as is usual for me, I had a sore kind of arm for a little bit after the flu vaccine. Had mild, maybe fatigue the next morning from the COVID booster, although maybe I just needed more sleep, and I was at the gym the next day. So, I got through both.
Yep, very efficient. We have another question here for Dr. Kraft. Is it recommended to switch brands from COVID shots to boosters? Can you switch Moderna and Pfizer, or should you stick with the same one that you've had?
There's actually some evidence now that shows a benefit of mixing and matching the 2 mRNA vaccines. So there is a positive benefit from mix and match. And there was a short time where we had a decrease in the supply of the Moderna, and we were encouraging everyone to just go ahead and get the Pfizer bivalent booster if they didn't have Moderna available. That short-term supply constraint has now resolved, and we have plenty of bivalent boosters for both Pfizer and Moderna.
Okay, great. Here's another question for either one of you to answer. Given the widespread view that the pandemic is over, how would you persuade residents to get this booster? And is there a need to continue promoting primary vaccine doses? What can healthcare providers do on this front? For individuals, how can they start that conversation?
So I'll start, and then Sally, I'm sure you have a number of things to add here. I would say that across New Hampshire, we have had ongoing disease activity all the way through the summer and into the fall, and we're beginning to see an uptick again. The number of individuals in the past few weeks that have kind of reached out to me, family, friends, colleagues, who've just been traveling and happen to have become ill. Thankfully, many because they're vaccinated, not with serious illness, but it's keeping them out of other activities, keeping them out of work. We do know in the school system in New Hampshire, as much as is being reported, we're seeing a lot more cases this fall than we did the fall prior. Again, we don't have masks in the school. We would expect to see an increase. And again, in pediatrics and younger individuals, it tends to be fairly mild disease, but it is impacting individuals' education if they have to stay home from school. So as you think about what you can do to provide that protection, as we are doing more things out and about in the community, gathering together, traveling, all the things that bring us back to this sense of normalcy, there are things, and probably the most important part of that is getting the protection from being up to date on vaccination. We do this with many other vaccines, this is just like this. This has now become an endemic virus, and it is something we can protect against.
All right, great. We actually have two more quick questions because we're just about at time, but I want to make sure we get these two in. For someone who has recently had a COVID-19 infection, what is an ideal length of time to wait before getting a bivalent booster?
Yeah, the CDC will actually, Centers for Disease Control and Prevention actually recommends about 3 months. There's some data that suggests even going as far out as 6 months. So I would say in general, I would wait 3 months, about 3 months between disease and bivalent booster.
And
Okay.
I think the point to that, which is important, is you're going to have protection from your recent infection. So you're going to be protected over that 3-month period, maybe even out to that 6 months. And because we know the vaccines wane over time, just like the flu vaccine does, by getting that booster 3 months from now, you'll prolong the period that you have protection all the way out through to late spring.
It won't hurt you to get the vaccine closer to the time that you had COVID-19 infection. So there's no harm. It's just as Dr. Calderwood said, spread out that immunity as long as you can.
Mm-hmm. Excellent. And our last question before we wrap is, if you've already had 2 boosters, is it still necessary to get the bivalent vaccine?
Yes. Get your bivalent vaccine 2 months after your last vaccination. Obviously, we don't have, we have the bivalent booster for 12 years and up right now available. We're anticipating in the next couple of weeks that bivalent booster will be approved for 5 years and up. But yes, you do need to get the bivalent booster, and you should time it 2 months after your last vaccine, or 3 months after, or 3 months after you've had COVID-19 infection, 3 to 4 months.
All right, excellent. Well, we're at time now, and we've answered our viewer questions. So Dr. Calderwood and Dr. Kraft, thank you so much for your time and your expertise. And to all our viewers, thank you so much for tuning in. And we will have a recording available of this on our Dartmouth Health website. So thank you all. Take care.
Thank you.
Thank you, Audra.